But why this seemingly urgent issue is still without a solution? One of the answers hides in the nature of depression itself. It's heterogeneity. This complex word simply means that depression, despite the same diagnosis, can look and feel different from the one person to another, have different origin, and thus require a different approach. The way we treat depression right now is largely a guessing game. Doctors prescribe treatments and medications based on the general guidelines, not being able to tailor the treatments according to personal needs. Because everyone's experience with depression is different, it simply means that patients have to try medication after medication after medication before finding one that works, if they find one at all. This trial and error process can be lengthy, emotionally exhausting, and even dangerous, because it can worsen the symptoms and increase the risk of self-harm. Our knowledge of the brain and how it works is at very early stages. It's like we are at the start line of a marathon. But the good news is that novel technologies like artificial intelligence or machine learning can be game changers. They hold potential to unravel the complex nature of mental disorders, develop novel treatments, and ultimately save lives. Imagine a future in which we don't just trying to treat depression, but we actually understand it. We've redefined it, and we view it not as a set of symptoms, but as a complex condition with identifiable causes. This is a future that machine learning and artificial intelligence offer us. In this future, we could use a broad range of biological data, such as MRI and PET scans, electroencephalography, electrocardiography, genetic and epigenetics markers, to gain better and comprehensive understanding of what's happening within a person's brain and body. The first step of this future is stratification. Artificial intelligence and machine learning can help us identify specific patterns linked to different depression types and treatment outcomes. This can allow us to group patients in distinct clusters or subtypes, each associated with different symptomatics, different biological markers, and predictable treatment responses. But we don't stop at the stratification. The next step is personalization. Once we identify the depression subtypes, we can move further and improve and tailor treatments according to unique biological profile of the patient. The advancements of technologies can help us understand the neurological and biological causes of depression and depressive symptoms. And this deeper understanding can lead to development of new therapeutics and early identification and even prevention of the mental health disorders. This is not a dream, but this is a reality that gradually taking shape. Recent studies demonstrated that machine learning applied to large sets of the fMRI data or electroencephalography data can actually identify distinct subtypes of depression. Other studies demonstrated that machine learning have a potential to predict treatment response for specific antidepressants before treatment begins with incredible accuracy. This progress isn't just about advancing technology or accumulating data. It's about real people, like my friend, Jay. In this future, Jay wouldn't have received just generic diagnosis, major depressive disorder, but instead her unique biological profile would define her depression subtypes. Her treatment plan would be personalized according to her brain scans or DNA data. AI and human experts would collaborate to better understand her condition and guide her treatment. And maybe then, Jay wouldn't have left hospital towards a tragic end, but towards a beginning of a brighter and healthier future. Thank you.